Hello, my name's Andrew and I'm here to tell you about the Anklemate exercise. As you know, physiotherapists like to use resistance band like this to gently exercise muscles by putting a little resistance into the stretches. However, there's one group of muscles for which this is extremely difficult to do, and that is your ankle dorsiflexors, simply because there is nothing underneath your foot to attach to, and current solutions such as lying on tables do not really give you the benefits that are required. A new approach is therefore required, and this is why the Anklemate was developed by NHS physiotherapists to help them in their work of strengthening ankle exercises. This is an Anklemate. It simply consists of two pieces of wood with some connectors which will enable you to attach resistance bands and therefore exercise your dorsiflexors from underneath. What you need to do now is put a chair on the Anklemate. The chair legs sit in the two slots in the Anklemate boards. The Anklemate will work with most chairs. It is also possible to use wheelchairs, providing it can fit into the slots as well. The patient then sits on the chair. The patient's weight will keep the chair secure and it will prevent your resistance band from moving whilst exercising. The patient should take their shoe off, although we recommend that they keep socks on, both for infection control purposes and also to prevent injury to delicate skin in older patients. The physiotherapist can attach resistance band. Now I've tied a simple loop there, and that can now be placed over the hook, brought over the patient's foot and secured in place with a figure of 8. The patient can now exercise the dorsiflexors quite happily. You can of course use different strengths of resistance band for different levels of training. It is also possible to work your eversion and inversion muscles. You can of course use different strengths of resistance band to vary the intensity of the training. You can work other muscles such as inversion or eversion. In fact, most muscles can be exercised providing you want to stretch from below. This has been used successfully in hospitals for patients with many different conditions such as neurological conditions like multiple sclerosis, Parkinson's disease, motor neuron disease. It has also been used with musculoskeletal injuries and also children. The uses are as many as those who require ankle training. The Anklemate is easily cleaned with wipes for infection control purposes, and it is available in a range of colours to suit your hospital environment. As you can see, there are two cleats on the front of the board. This enables bigger people, such as men, to use the front one because their legs are bigger, and smaller people or children can use the back one because their legs are smaller and can't reach as far. So again, if I put the resistance band over, I can exercise my foot here. Alternatively, I can bring this round over my knee, secure to the other end, and I can do this exercise. There's also a cleat on the back, and that enables me to do arm exercises. So I can now stretch right up, I can stretch round, I can go forwards. It is entirely up to you as a physiotherapist to determine which exercises are best for your patient. The Anklemate will accommodate very many different exercises.